Topic of the day, Ozempic and Mounjaro. We're going to discuss that today.
Everyone in my clinic, every day in my clinic, 5 to 10 people are asking for Ozempic and Wegovy or Mounjaro.
Is it
and
true?
it's the same happening with him, so we'll ask him also.
Is it true practically most doctors' wives are on Ozempic? Who should be on Ozempic, and what's the difference between Ozempic and Mounjaro?
So, semaglutide, they actually come up, the Ozempic is in the market for past few years. It has been marketed for diabetic people to actually bring down your A1C, to lower down your A1C. It's a once weekly shot. They also mention with Ozempic you can lose weight. You can also lose weight with other medication, but this medication you can lose weight. Then a celebrity from the Hollywood, I think it tweeted or something that she lost weight using this medication. After that, everybody wants this medication. The way it works actually, it slows down your gastric emptying time. So definitely you feel full, you feel nauseated, you don't feel like eating. So that's the one thing, it actually reduces your appetite, so you start losing weight. Every medication has a side effect, and this medication also has a side effect.
Now, tell me two things. How does this medication work, and what are the side effects to watch out for?
More of them are weekly injections. More of them are working on the same pathway, which is a GLP-1 pathway. They are telling your pancreas to increase the production of insulin and decrease the production of glucagon. And when they are working through the pancreas, that's where your second point actually needs to be discussed as well. Side effects. It can affect your pancreas.
So when you say it can affect the pancreas, I'm a little concerned about pancreas because usually it's hard to find problems with pancreas. Usually if you have pancreatic cancer, you don't have any symptoms. The only time you have an issue with pancreas is when you have pancreatitis. So when you're taking this, what type of side effects does pancreas show?
So again, you have these symptoms of nausea, vomiting, bloating and all those. They also mention in the literature that it can affect the kidney as well, specifically someone who has a chronic kidney disease that can be affected. But the question about the pancreas is an interesting one because these medications are in the market for the past few years. I've sent people to the gastroenterologist with elevated amylase and lipase.
So tell me more about amylase and lipase.
And amylase and lipase are the two enzymes that are released from the pancreas. And they can, when they are high, then there is a chance that your pancreas is getting inflamed. Now,
so let me explain. So you're telling me that the pancreatic cells are there with amylase and lipase. They release amylase and lipase into the pancreatic ducts, the tubes, and then it gets dumped into the intestine. But they're not supposed to enter the bloodstream. That means, how are they entering the bloodstream? That means there must be some disruption of the cell membrane of the pancreas, which is causing the enzymes to leak into circulation, and that's how they're coming into circulation, not through the gut.
Not through the gut, sir. So whenever these enzymes are high, then the next question come in the mind is, if you look at the medication side effect, they do mention about elevation of these enzymes. So it means these medications are working through the pancreas. I don't know whether they are causing some sort of an inflammation.
But can that cause scarring of the pancreas? Because if you keep destroying the pancreatic cells slowly and you keep spilling the amylase and lipase over a period of time, could that also lead to chronic scarring? Because remember, in pancreatitis, what happens? The enzymes come out and they start eating everything around. Does something similar happen in this case?
We don't know yet. That's the problem. I've talked to few gastroenterologists because we have few patients who are taking Ozempic, Mounjaro, even medications like Januvia, Tradjenta, all these medications working through the pancreas. So there are patients who amylase and lipase are high, and we exactly don't know what's going to happen few years from now. But yes, we go and do a CT scan, we do an ultrasound, we make sure the pancreas is okay. If their pancreas is fine, then we let them continue with this medication. Now, if you have any pain, if you have a sign of pancreatitis, definitely you need to stop this medication and you cannot go back on this medication.
What is the one test that's a great test to check for pancreas?
They are doing a lipase, Dr. Reddy. This is one of the blood tests that you do it, actually lipase and amylase, just to make sure that pancreatic enzymes are okay. But again, if the enzymes are high, then will you go on a CT scan or imaging to make sure pancreas is okay?
So they do recommend CT scan.
CT scans.
So anytime I see a particular marker or an enzyme in the blood when it is not supposed to be there, it bothers me. That means the enzyme has leaked from the cell. And how does an enzyme leak from the cell? That means you must disrupt the cell membrane for the enzyme to leak from the cell. Now, if you disrupt the cell membrane, what happens to the cell? There's most likely the cell will be damaged. And if you damage the cell, could that cell die? And if the cell dies, could it be replaced with scar tissue? And if you keep doing this time and again for months on end, up to years, could you eventually end up with scarring of the pancreas, which is of concern for me.
You're right. And then you have to also look for the other causes. Alcohol. Do you have any pathology going on with the gallstone? Do you have any stones, anything like that? Do you have any other autoimmune condition going on, or your lipids are high? There are other reasons for the pancreatitis also. So we remember get smashed like gallstone, ethanol, trauma, all those things. But you also have to remember that recent studies and recent journal which you also read, they talk about weight loss is so important, and these medications, it is advisable to prescribe these medications because they think obesity is a major cause for a lot of medical issue. And if this medication can make you lose 20, 30, 40 pounds, and then why not?
So I have been telling my patients to go to their primary care physician and get the medications to help them lose weight, because as you said, helping them with losing weight would help with their sleep apnea, with their blood pressure, with their blood sugar control, with their knees, with their inflammation, from every aspect. Fatty liver, it actually helps. So I am actually asking them to go and talk to the doctor. Now, there was a report I heard that Mounjaro had less side effects than the other two. Is that correct?
But you're right, Dr. Reddy, about Mounjaro. But again, I've seen few people with the Mounjaro. They have elevated amylase and lipase. So again, these medications initially, Wegovy was marketed for the weight loss, not the Ozempic, not the Mounjaro. They will only be given to the diabetic, but there is an additional benefit that they can lose weight. But nowadays, all these three medications been recommended for the weight loss, and specifically if you're diabetic with all those chronic medical conditions that Dr. Reddy mentioned, I think it's very beneficial. But the next most important question, if I'm diabetic, that's different. If he's not a diabetic and he's taking for the weight loss, how long are you going to take that medication?
I'm told that you have to take it for a lifetime. Is that correct?
That's correct. That's by the general and literature. But the question you also pose, that if it's working through my pancreas and causing my amylase and lipase to go up because again these cells are inflamed, will I continue this medication for the next 5 years, or shall I just take it for 6 months, lose weight and work with my diet and exercise and give it a honeymoon period, or stop the medication?
Can I do that? Can I take it for 6 months or a year and then stop and then go on a strict diet and exercise? Will I be able to prevent weight gain again?
That's up to you. Again, there are so many factors against you. Are you a person who's strict on a diet? Are you a person who's going to strictly follow the regimen, or you're a person who's going to take the medication, lose weight, and after that you'll stop and start eating again and gain the weight again? I don't know what personality you have. It's a very difficult question to answer. But again, am I going to take Ozempic for another 20 years just for the weight loss? I'm going to put a chemical in my system for another 20 years for a weight loss, despite knowing that this chemical can affect my pancreas, my kidneys, and there's a chance, very, very small chance of medullary carcinoma of the thyroid. Am I going to take that chance? And again, studies will show in the future.
So is there a chance of lymphoma or just medullary cancer of thyroid?
They did mention about medullary carcinoma of the thyroid. And again, Dr. Reddy, all these medications, again, when we start these newer medications, again, they are not new. They've been there in the market for the last few years. But again, nowadays the recommendations are new, and we don't know how long am I going to take this medication for a weight loss. And again, every now and then after a few years we find out, do not take aspirin, it can cause this issue. Same thing you'll find out about Mounjaro. Oh, do not take Mounjaro, it's causing pancreatic cancer, pancreatic issue, or Ozempic. I'm sorry, I don't want to label the medication, but they are good medication. But again, we don't know. What the time will tell. So
right now, the way we are seeing and what we are doing in our practice, we are prescribing these medications for encouraging patients to lose weight. Am I right in saying that?
Absolutely, because we are looking at the big picture. We are definitely seeing the benefit of the weight loss. So right now, we are definitely focusing towards the weight loss.
And we are encouraging them to take the medication regularly, so as to comply with their diet and help them lose weight.
That's the most important thing. Diet and exercise. Please do not totally rely on the medication. Do the lifestyle changes for sure.
Now, one last thing. I'm a little concerned when you said it decreases the gastric emptying time. That means the food stays in the stomach for a long period of time. If this food stays in the stomach for a long period of time, if I have sleep apnea, could I aspirate?
That's a very good point you mentioned, Dr. Reddy, because recently I found out that if you're going for a surgery, the anesthesiologist will ask you if you're taking Ozempic or not.
Why?
Because of the same fact you mentioned, it is reducing the gastric, slowing down the gastric emptying time, and there is always a chance of an aspiration or vomiting and aspiration. So now they are asking you to hold Ozempic if you're going for a surgery at least week or two.
For at least a week.
Week or two, yes.
So second, that brings up another point. So if I am on Ozempic or if my spouse is on Ozempic, I should also watch out for sleep apnea, because if you have sleep apnea, it is not corrected. That means every night you run the risk of aspiration.
There is
technically, from what you're telling me.
There is always a chance. It is slowing down your gastric emptying time. So there is always a chance that it can lead to it. Some people, they have vomiting with it. Some people felt nauseous with it. But so far, definitely, that's what I heard, that anesthesiologist wants you to hold Ozempic before getting it on
if that is a reality, then in that case, I should be telling my patients to sleep with 3 or 4 pillows so as to keep their head elevated to prevent the chance of aspiration.
Absolutely. If anything is slowing down, definitely there is a more chance of reflux, Dr. Reddy.
So that brings our next question. Do they have more symptoms of reflux?
Again, if anything is slowing down, there is always a chance. If you ask me personally that anybody complain about the reflux with me with an Ozempic, but I did not ask specifically. So I think that's a good point to be asking with the patient, are your reflux symptom getting worse when you're taking Ozempic?
Thank you.
Thank you for watching. If you like this video, make sure to subscribe so you can be notified when new videos are posted. If you know anyone who might benefit from this video, please share this video with them. Our goal is to educate more people by making simple lifestyle and diet changes that work.